Okay, so myself and Lorraine, who's my colleague at Croydon BME Forum, are working in partnership representing the BME Forum and ARCC on behalf of our own partners on a joint venture to bring awareness to cancer screenings to the forefront. I'm sure of you have seen reports or news relating to cancer affecting everybody worldwide. We are here to ensure that the Black and South Asian community of Croydon have the necessary information and support. We've been speaking with people, some of you in the local community, and trying to gain an understanding of why cancer screenings amongst the Black and South Asian community is so low. Just a few more people I need to invite. So as I said, by myself today, so getting distracted with admitting people. So I'd just like to introduce Kiran, this evening's speaker. We feel honored to have Kiran speak with us today. Kiran is a consultant nutritionist and is passionate about helping people as a nutritionist and has worked for NutriFact Life. Kiran has experience working both in the UK and Pakistan, having gained her master's at Sheffield Harlem. Kiran has working knowledge of the NHS as well as Pakistan's healthcare system. We are lucky to have her give a talk on the importance of nutrition and breast cancer for the Cancer Awareness Program, or CAP, in Croydon. Kiran, is this correct? Inyat?
Yes.
Inyat?
Yeah.
Okay, thank you very much for joining us this evening. Please, could you just help us understand what exactly is breast cancer and how nutrition can affect it?
All right. Thank you so much for such wonderful introduction, Tom. And here we are going to talk about the nutrition. So I need to actually share my screen, right?
Yeah, or I can share it. I was just trying to just tap onto Zoom. Okay, there we go. Screen. Okay, cool. Can you all see that?
Yeah, I think it's fine. I can't see. Wait a second.
Let me just. Okay.
All right.
Okay, or would you prefer the first slide?
Yeah, it's fine. So you are going to change the slides, right?
Yeah.
Okay. Fine.
Yeah, just feel free to shout out.
Okay, cool. So yeah, today's topic is nutrition and breast cancer. So the objectives of today's presentation will be, can you please change the slide, please? Okay, yeah. So first we are going to talk about what is breast cancer and what are the statistics of breast cancer around the globe and in UK. And then we'll move on the risk factors of breast cancer, then nutrition in breast cancer, recommendation of breast cancer, and what is the main role of nutrition in the breast cancer treatment, prevention, and recurrence and mortality. And then we'll move to the conclusion. Next, please. Next, what is breast cancer? So breasts are made up of fatty connective tissues, milky productive glands, and ducts that carry milk from the gland to the nipple. Breast tissues naturally develop in response of hormones at different stages of life, for example, like puberty, pregnancy, and breastfeeding. Can you please change the slide, please? Yes, so breast cancer almost always develop in the glands or ducts that produce milk and carry it to the milk. Cancers developed as a result of cell being damaged, with which then grow uncontrollably, forming a lump or thickening called tumor. There are also other important risk factors that you can do something about, such as your diet and lifestyle choices. Next, please. All right. So to see why a breast cancer is really important right now and why we are here to talk about it, we need to see what are the statistical numbers for it. Can you please change the slide, please? Yeah, so the worldwide incidents are like breast cancer is the second most common cancer worldwide and most commonly occurring malignancy in women, with more than 2 million of new cases diagnosed in 2018. But thanks to the early diagnosis with the mammogram screening and improved surgery and treatment, in 2018, breast cancer deaths have rapidly slowed down to 6.6%. However, survivors are at increased risk of reoccurrence, weight gain, and developed other comorbidities such as obesity, cardiovascular disease, metabolic syndrome, etc. Next, please. So the picture in UK, the breast cancer is the fourth most common cancer in the UK, and it's like at every eight one woman develops the breast disease at some stage of lifetime. So, breast cancer is very rare in men, with around 400 new cases diagnosed each year in UK, compared with 56,987 new cases in women in last 2019. And each year, approximately 11,500 women and 80 men die from breast cancer in the UK. Breast cancer is the leading cause of death in women under 50 years in the UK. Next, please. So breast cancer survivor rate has improved and doubled. As I have mentioned before, it has been now 6.6%. And in UK, in past 40 years, it has been doubled. Because of the combination of improvement in treatment and care, earlier detection through screening and quick diagnosis. So approximately 87% women survive from breast cancer for 5 years or more, and approx 6 million people survive in the UK after diagnosis. And this 6 million people, the surviving rate predicted to be double into 2030 by 1.2 million. Next. So as we have seen, breast cancer, how common it is, and now we need to see what are the risk factors behind it. Next, please. So the main risk factors are age, family history, height, and early menarche, like the women who develop their periods as early as less than 12 year of age, and late menopause, like women who develop their menopause as late as less than 15 year of age, having first pregnancy after 30 years of age, infertility, taking oral contraceptives, taking any hormonal replacement therapies, and exposure to X-rays, like radiations, at the time of puberty. Next, please. So as I have mentioned so many risk factors, we have to see what are the main risk factors and how we can change it, and we can improve our quality of life. So as far as World Cancer Research Fund UK stated that 23% of breast cancer cases in the UK may preventable, and from which 1% breast cancer are caused by oral contraceptive, 2% breast cancer is caused by postmenopausal hormones therapy, and 8% breast cancer cases in the UK are caused by overweight and obesity. 8% breast cancer cases in UK are caused by alcohol consumption, and 5% breast cancer cases caused by not breastfeeding. So as we can see from these numbers, 8% and 8% and 8%, these are the overweight and alcohol consumption. These are the main risk factors, and then followed by not breastfeeding. Next, please. So International Agency of Research on Cancer or World Cancer Research Fund, I have mentioned this before, state that 23% of breast cancer cases in the UK may preventable. Breast cancer is associated with number of risk factors. Some risk factor I have already mentioned above in my previous slides, and some are written here. But there are some convincing evidence, and some have like limited evidence, but all the evidence the researches have been done in different aspects. So we are going to talk about in later slides what are the importance and what we have got in like limited evidence. Next, please. So the lifestyle factors. I have mentioned in the risk factor chart, overweight and obesity, drinking alcohol, no physical activity, unhealthy eating, and not breastfeeding are the main lifestyle risk factors that are associated with breast cancer risk. Next, please. So what is the role of nutrition in breast cancer? Next, please. So nutrition may reduce the risk of breast cancer. Nutrition may help to improve breast cancer survival rate. Nutrition therapy all alongside with cancer therapy can provide favorable outcomes. Nutrition may decrease the chance of breast cancer reoccurrence, weight gain, and other comorbidities like obesity, diabetes.
Sorry, Kiran. Have you just moved your microphone?
Sorry.
It's all right.
Is it fine now?
That's great. Thank you.
All right. So next slide, please. Yeah, so World Cancer Research Fund UK recommendations are, the main recommendations are being healthy weight, being physically active, limit your alcohol, and breastfeed your baby. But they have like other recommendation as well. Through this figure, you can easily understand the other recommendation, like be a healthy weight, do physical activity, eat a diet rich in whole grains, vegetables, fruits, and beans, limit your fast food, processed food, fats and sugars, limit your consumption of red meat and processed meat, limit consumption of sugar and sugar beverages, limit alcohol consumption, do not use supplement for cancer treatment or cancer prevention. For mothers, breastfeeding your baby if you can. After cancer diagnosis, follow a recommendation if you can. So these are the whole recommendation from VCRF. And the main, we are actually going through all of these recommendations one by one. But the main are the being healthy weight, being physically active, limit in alcohol intake, and breastfeed your baby. Next, please. So how breast cancer actually correlating, like is there any relationship between overweight and obesity? Being overweight and obese actually increasing the risk of at least 12 type of cancers, including breast cancer. Because being overweight can affect your estrogen level, insulin resistance, and inflammation. Body fat directly affects the level of circulating hormones in your body, and high level of circulating hormones like estrogen is linked to higher risk of developing cancer cells. On the other hand, insulin also, if you are storing too much fat in your body, it will affect your insulin sensitivity, and then then that insulin affects your hormones, and then if there is too much hormone in your body, like estrogen, will affect your to affect your inflammation, and then it will provide a favorable environment to your body to develop growth cell or to grow growth cell. Same as for inflammation, if you are storing too much fat, you are actually stimulating low level of whole body inflammatory response, and inflammation can promote to grow of the cancer cells. Next slide, please.
Just before we go on, Kiran, sorry, can you just adjust your microphone again, please? Just a sound check. I think it got covered again during that side.
Can you hear me now?
That sounds good. Yeah.
Is it fine?
Yeah, that's good. Thank
All
you.
right. All right.
Sorry, thank you.
All right. So breast cancer and overweight again, post-menopausal. Now I'm talking about the facts and the evidence that we have got from the research. Post-menopausal breast cancer risk is about 1.5 to 2 times higher in women who are overweight and obese, even within the normal range of BMI, which is 18.5 and to 24.9. I'm going to talk about BMI in my later slide, but in my next slide, with higher level of body fat are associated with increased risk of breast cancer after menopause. Next slide, please. So the predictors of being overweight or obese, you have to calculate your body mass index. The normal range of body mass index is 18.5 to 24.9, and you can easily calculate it. It's available on NHS website. It's available on a World Cancer Research Fund. I have provided the link in my resources slide. You can just click on it, provide your details. It requires your height, your weight, and your age and your physical activity level, and then it will give you your BMI. So if you are over 24.9, you consider as overweight. And then if you are over 30 or 32, is considered as obese. And another marker to, measure your obesity or overweight level is waist measurement. So you can do it by yourself at your home. The healthy waist is for men less than 94 centimeter, which is 37 inches, and for women is less than 80 centimeter, which is 31.5 inches. Next slide, please. So the factors that influence our body weight are two. It's diet and physical activity. Like if you are taking excessive energy food, for example, you are taking food that are high in saturated fats and sugars and low in fiber, and you are eating more often, then you are obviously doing unhealthy eating, right? And if you are not doing any physical activity, you are in sedentary lifestyle, so it will start affecting your hormone, digestive system, immune response, and weight. Next slide, please. So this is a table which I have extracted from the World Cancer Research Fund report, and it says diet, nutrition, physical activity, and premenopausal breast cancer. And it shows some convincing and probable evidence, which in which you can see that attain height increase the risk, alcohol consumption increase the risk, and greater birth weight increase the risk. We are going to talk about more in depth in these factors. Next slide, please. So what is the relationship between the between different food groups and breast cancer? There have been many researches done in past couple of years, and like everyone is trying to find the perfect relationship between these two factors, but evidence are very limited and not conclusive. But it's better to mention these because these food groups are directly affecting your weight. So if you are working on your diet, you are actually affecting your weight, and then weight is like direct correlation with the breast cancer, inverse correlation. So first talk about fruits and vegetables. Fruits and vegetables have polyphenols, fibers, and beta carotene, and these have antioxidative property, anti-inflammatory, anti-carcinogenic, improve insulin sensitivity, and reduce weight. So these are the properties of fruits and vegetables, but the evidence are borderline and limited. Again, red meat and processed meat. Red meat, processed meat have protein, iron, zinc, vitamin B12, but and because of their high heme level, it affects your cancer. It helps to develop cancer. So if you are taking like red meat, you are increasing 6% high. You are having 6% high risk of developing breast cancer. And if you are taking processed meat, you have like 9% high risk of developing breast cancer. But the results are so not conclusive. And then dairy products have calcium, vitamin D, butyrate, lactoferrin, unsaturated fat, which is low, in low fat products. I have specifically mentioned it because of one reason. I'll tell you in later slides that it has anti-carcinogenic property, and but in dairy products we have found both inverse and positive association because of this saturated and unsaturated fat in the dairy product. So if you are taking low fat milk or low fat dairy products, it is good for your breast health. But if you are taking full milk or like full cream, like full cream, cheese and all dairy products, you are actually uh, providing again the same thing, that you are like developing cholesterol level and all. As I mentioned in the last raw dietary fats, saturated fats, and the unsaturated fats. So saturated fat has carcinogenic property, accumulation of adipose tissue, high level of cholesterol. So these all have some differences, but the the results are not so much authentic, and there is some research needs to be done. Next slide, please. So these are the dietary recommendations from World Cancer Research Fund, UK. Limit your red meat about 350 to 300 grams per portion, for no more than 3 portions per week. Aim for a minimum of 5 portions of different colorful fruits and vegetables daily, but in a combined form. You can't like just take only fruits, or you can't just can't rely on only vegetables. You have to take in a combined form. So try to choose whole grain starch food which are low in fat and rich in fiber. Avoid taking refined carbs. Aim for 2 portion, like 80 to 120 gram of meat other than red meat. I'm talking about like fish and chicken on daily basis. And this 80 to 120 grams differ from the it's like which kind of meat you are taking. Avoid processed meat, smoked meat, and smoked fish. You should take daily calcium that provide 400 to 600 of calcium, preferably one also contain vitamin D, because calcium has like very strong evidence that it's actually may provide inverse relationship between calcium intake and uh, breast cancer. So if you are taking enough calcium in your diet with a good sufficient amount of vitamin D, like if you can take a fish, you can take low fat milk, you can take some seeds, you can take different cheese and all. So you will be taking a vitamin D with calcium, with selenium, everything in it. So, and polyunsaturated fatty acids like omega-3 fatty acids, it's present in the fish. You can take seafood, they have lots of omega-3. And limit your saturated fats like sausages, pies, pastries, chips, crepes, etc. Limit your intake of sugars and sugary foods, for example sweets, chocolate, pudding, biscuits, etc. Next slide, please. So alcohol intake, this is a very important point, and it's like the evidence are quite strong. A strong evidence available that alcohol intake, any kind of alcohol intake, even beer, wine, spirit, uh, it's like have pre and post menopausal breast cancer risk, increase your risk. Every 10 gram of ethanol consumed per day, there was an associated statistical significant increased risk of about 5% premenopausal breast cancer and 9% postmenopausal breast cancer. Next, please. So the recommendation from World Cancer Research Fund is to completely avoid alcohol. Like you don't have to take alcohol at all, because they have like convincing strong evidence for it. So if you are taking alcohol, think twice. So next slide, please. But if you want to take alcohol, you can take 14 units per day, which should be spread at least 3 days for men and women. And there is some calculations on the screen. You can take a screenshot if you want. That wine one small glass of like that contain 125 ml of wine have 1.5 units beer and then spit. And there is also a useful link in the resources slide. You can click on that. You can calculate your intake by yourself as well. Next slide, please. So the physical activity. Physical activity, the women who get regular physical activity have 10% to 20% lower risk of breast cancer compared to women who are inactive, with greater risk reduction associated with increased level of risk. And as I have mentioned before, physical activity affects your hormone, digestive system, your immune response, and your weight. And they are basically two main kind of physical activity: the moderate intensity and vigorous intensity activity. So if I'm talking about moderate intensity activity, it will make you feel warmer and breath faster, but you should still be able to talk. This is the definition of moderate activity. And vigorous activities will raise your heart rate and make you start to sweat and feel out of breath. So this is vigorous activity. Next slide, please. So the recommendation for physical activity is you should need to do at least 150 minutes of moderate intensity a week, or 75 minutes of vigorous activity a week, or even shorter duration of very vigorous intensity activities such as sprinting or stair climbing, or a combination of moderate, vigorous, and very vigorous intensity. And these from this picture you can see what are the moderate physical activity: walking, gardening, hiking, dancing, cycling, active recreation, and swimming. These are all your moderate physical activity that you can do on daily basis. Next slide, please. So breast cancer, this is another risk factor of breast cancer, breastfeeding. So risk of breast cancer was reduced by 4% for every 12 months of breastfeeding. It has been like seen in some researches. Decrease the risk of breast cancer with increased duration of breastfeeding among pre and post menopausal women. Next slide, please. So what are the benefits of breastfeeding? If you are for a mother, it may lower your cancer hormones, remove cells with DNA damage, remove the damaged cells from the breast. And for the baby, it will grow the baby with healthy rate, maintain healthy weight, and provide a strong immunity. Additional benefits include protect baby against infection, build physical and emotional bond between mother and child. So these are some like benefits of breastfeeding. And the recommendations for breastfeeding are, next slide, please. So infants be exclusively breastfeed for about the first 6 months of life, and that breastfeeding should be continue for up to 2 years or beyond, alongside other appropriate food and drinks. So now we'll move on the part where we are going to discuss the role of nutrition in survival rate, breast cancer survival rate, treatment, and mortality. Next slide, please. So nutrition during the breast cancer treatment. So actually, there have been many evidence, clinical prevalence of nutrition intervention in patients with cancers, with aim to ensuring an adequate intake of energy and nutrients during chemotherapy. So changes in taste during breast cancer treatment are mainly because of the damage of the receptors on tongue and stomach. So because of this, people report to like avoid certain kind of food that may lead to them malnourishment, and also deficiency they have start developing deficiency of micronutrients, especially they have like deficiency or low intake of protein and fat. So for this reason, appropriate nutritional guidance and counseling is very important for a patient with while they are having the treatment of breast cancer. And also they can try different condiments, spices, and different flavors. They can take a candy before meal. They can drink sweet drinks to make to feel something good. Like these kind of stuff they can do to like we can encourage them to take these kind of stuff, to take appropriate amount of nutrients, and uh, not not have like being not being malnourished. Next slide please. So although there is like insufficient clinical evidence established on these parameters, like these food groups, but it's better to mention it, like omega-3 polyunsaturated fatty acid. It's present in seafood, as I mentioned before. It's also present in nuts and seeds. It has some what like a small positive correlation, like it if you are taking omega-3, you are improving your overall health, overall nutritional health. And green tea, because green tea have flavonoids, polyphenols compound, and antioxidant properties, so it provide anti-inflammatory response in the body. Fruits and vegetable, as I mentioned before, rich in vitamin C, vitamin E, and D, minerals like selenium and calcium, which are very important while if you have breast cancer. So this is another one. Next slide please. So nutrition in breast cancer, reoccurrence and mortality. So dietary fat reduction by 20 to 29% of total calories, improve survival rate, and reduce body weight. Actually, there has been research. It was a big research, women intervention nutrition study, and 2,437 participants were included, and they divided those participants into two groups. One was assigned to take a normal amount of fat, that is 30% of our total calories, and other one was assigned to take 20 to 29 percent of fat from the total calories. They actually observed the improvement in the survival rate, and also they observed their weight has been reduced. There was another research, it was a cancer prevention study, nutrition cohort, in which they actually see the association between red meat and processed meat with breast cancer. So they actually found a significant lower mortality rate, the person who are like avoiding or limiting their red meat and processed meat. And then 5 to 6 portion of fruits and vegetable combined, 30 grams of fiber each day. And then soya products. There are some research has been done in Chinese women's, but the evidence for Western women are quite low. But actually, Western women don't consume that much soya products as compared to Chinese people. So they actually found that their surviving rate and their reoccurrence of breast cancer reoccurrence has been quite low in patients who are taking soy products, like 30 grams a day. Next slide, please. So in conclusion, according to the World Cancer Research Fund, the American Institute of Cancer Research, maintain healthy weight, being physically active, following a fiber and soy-rich diet, limiting the intake of fats like saturated fats, may improve overall survival after breast cancer diagnosis and may prevent breast cancer in early life. In addition, lifestyle changes including diet and exercise can reduce the long-term side effects of treatment protocols and promote long-term overall health by reducing breast cancer comorbidities, for example, hypertension, hyperlipidemia, cardiovascular disease, diabetes, etc. Next slide, please. So these are some useful resources. The Eating Well guide for from the NHS, Eat Well During Cancer, and the Eat Well plate. The Eat Well During Cancer and the Eating Well of Breast Cancer from NHS, these two booklets, you can download it. I have provided the link and you can download it. It has actually mentioned everything It provides you the portion size, what things you need to take, what things you don't need to take, and what things you need to avoid completely. How much like if you are taking milk, how much milk you need to take per day. And they have also recipes as well, so you should go check it out. That next slide please. So this is just a resource. Next slide please. Resource slide. I have provided the things that I've used and I've mentioned here. It also have the calculator for alcohol calculation, for body mass index calculation, and the booklets of these that you have to download. Thank you so much. That's all from me.
Thank you so much. Thank you, Kiran. That was yeah, that was very informative. I'm just trying to bring the video back on. Stop sharing. Sorry, just trying to navigate back to the script. Great. So yeah, we're just open to questions. If anyone would like to ask Kiran a question, just please raise your hands using the more. Sorry, if you click on your screen. And no, it's not. It's not Teams. Sorry, Mr. Teams. Yeah, you can type a question in the chat, or ask to unmute. So I mean, can't see anyone at the moment with a question, so I just open up. So are you saying that by reducing red meats, that's one of the main things you can do to help reduce breast cancer? And if so, is there a difference of are there any other dietary requirements to do so within male breast cancer as opposed to female breast cancer?
It's just you if you are talking about the dietary requirements, you need to take a diet rich in fiber, which is more important. And then you have to limit your not completely avoid, but limit your red meat, like I have mentioned, 3 portions a week. And including that, you can increase your soy consumption. As we have seen, there are many researches done in the as to take like soy products actually affect your risk of not having breast cancer. But in term of male and female, there is not quite research being done, so I'm not sure about that. But yeah, you need to take a fiber rich diet, which should be include fruits and vegetables. Take calcium, because there's strong evidence for calcium, and with the combination of vitamin D.
Vitamin D. Okay.
Yeah.
Great. Thank you. As you can see, Amjid has a question, which are there any cuisines recommended for breast cancer, reducing the risk of breast cancer?
Cuisines like in term of like a diet or a dietary pattern.
Yeah, I suppose is there a meal out there that exists that's high in fiber, low red meat?
Yeah, you can say like the Mediterranean diet has been shown, because they have like olive oils and olives, and they use more beans and starchy vegetables and starchy whole grain products as compared to a Western diet. You can say that, but it's not recommended that you can just follow a Mediterranean diet. You should aim to introduce more healthy habits and do physical activity with that, because if you are just focusing on your diet, you are not doing any physical activity, then you won't be able to get the full benefits of it. So you need to do some physical activity. You should include the fiber in your diet. You should include avoid red meat, avoid alcohol consumption. So then that can matter.
That's really interesting. Yeah, and I think that's an interesting point as well. It's not just about the food. I suppose if you can eat as healthy as you want, but if you never move,
Yeah.
it's not going to help. Somewhat, Sarah has asked, once diagnosed and getting treatment, should you then reduce or avoid sugar altogether?
Yeah, actually, there is a myth that if you have a breast cancer, you should avoid sugar completely. But it's not like that. You can take sugar. You can't just completely avoid it. You can just reduce it. You can take in a form of jaggery, in a form of honey. You should avoid some refined form of sugar. So that you can do.
Okay, so similar like what you were saying with red meat or processed meat rather is
Processing. Yeah.
yeah. Okay. Um, and Amjad has also asked, do Indian, Italian, or Spanish, do these populations have a lower breast cancer occurrence? Um, well, that's interesting. Um, I would have to look up the facts of that. Obviously, that's part of why this program exists is because there's a lower uptake. Um, but I don't know, in your experience, have you noticed any difference within a correlation between
It
what
was
countries are eating?
actually it was very low in India and in Pakistan in past couple of years, but it has been increased now because of the westernized and urbanization in India and Pakistan. So it has been increased. So we are not sure about it right now that it's at the same rate or not, but it is increasing.
Would you say when you say Western influence, would that be things like fast food chains?
Yeah, exactly. Fast food, processed meat, processed food, cane items, sugary beverages.
Hmm. Yeah, I was going to ask about sugar as well. So, there's a replacement used in a lot of soft drinks called aspartame. Um, would you say that's any? So I know it's in Diet Coke. Would you say that's better or is than normal sugar, or would you say again things like honey, a more natural sugar is probably better?
The more natural is always better, but it's this sugar is like digest very slowly in our gut, and it's not like a spike or insulin as compared like as sugar do, right? So as so you can take this, but if you are taking that thing in a very large quantity or you are taking more frequently and normal, then it will start affecting your gut, your microbacteria, your gut microbes, and then start affecting your insulin level. So everything in a limited quantity is be fine, but if you are taking an excessive, it start affecting your health.
Okay. I suppose it's like that old saying, like if you want a low calorie drink, don't do the diet option, do water or something instead, I guess.
Yeah, exactly.
Um, and you touched on something there. You were talking about gut bacteria. Is that why I know in certain South Asian cuisines, obviously yogurt is prevalent, and also I guess in the Mediterranean, because of the gut bacteria, is that why it can be good in moderation?
Yeah, actually, I've mentioned in my food and cancer, breast cancer table, it was written that in dietary products there is butyrate. Butyrate actually affects effective against our for actually for our microbe in the gut. So in like diet, like Indian diet and Mediterranean diet, they and even in Chinese food, they actually use yogurt more frequently as compared to a Western diet. So yeah, if you are providing butyrate and my probiotics to your gut, it will provide a friendly environment for your microbes.
Okay, interesting. Um, so Sarah has asked another question, which I think you've covered within the color of foods. I think you talked about different colors. So Sarah's asked again, whilst living with cancer, should one eat only organic foods, bearing in mind the high cost of it, or non-organic foods are okay too? particularly difficult to source certain organic food stuff. That's a fair point.
You can totally take in organic food. It's not about the things like it's not about the thing they are putting in. You can take fruits and vegetable, either organic or inorganic. Both have fibers, both have vitamin C, vitamin E, like selenium and calcium, all of that. So it doesn't matter at all.
Okay. And as you said, something like high in fiber, I suppose there's cereals out there which are
Yeah,
quite
whole grain
affordable.
cereals. Yeah, whole grain cereals.
Interesting. I don't know if you've got any other comments coming up from anyone. It's what we might. I can't think of any at the moment. I'm sure there will be later. That's Sarah again. Can you advise on the benefits of CMOS for cancer patients, considering the different types of cancer markers? That's all right, Sarah. Ask away. Don't worry about asking so many.
All right. So I haven't seen any research for CMOS yet. I can't recommend it straight away. But seafood actually have omega-3. All the seafood items like prawns and fish, sea bass, salmon and all have omega-3, and omega-3 have some beneficial effects in preventing breast cancer. So yeah, you can, in terms of that, you can take that.
It's great. And I suppose the other, I know a few people who have taken omega-3 tablets with oil. Thank you, Sarah. Um, yeah, it's really interesting. I think there was a Steve Jobs quote which was quite fitting. It was treat your if you treat your food as medicine, or if you don't treat your food as medicine, you'll end up eating your medicine as food, or something to that effect.
Yes.
Yeah, you are what you eat, I suppose. That's great. I'm sure there'll be more questions, but I'm just we powered through so quickly. So what I'm going to do, we're a little bit early, again, still open to questions. So feel free to write them in the chat. Oh, there we go. Is it better to take omega-3 as tablets or to try and find it in your diets?
Yeah, if you want to prevent breast cancer, you don't have to take any supplement. As then I was mentioning the recommendation of World Cancer Research Fund UK, it clearly mentioned to prevent breast cancer, you don't need to take supplement, right? You have to find it in natural ways, like in your food, nuts, seeds, oils.
All right. Yeah. Um, so just going through the presentation as well, I remember there was the point on BMI index. And I just wanted to give a quick shout out to Viknesh, who's on our long-term conditions project. And there's also I believe not Diane anymore. Sorry, there's a new person. Croydon BME also have a long-term conditions project. I think I saw Croydon BME on here earlier. They're still on. Give us a shout. All right, they've left the building. But yeah, the long-term health conditions. I used to be a health champion, and we did BMI index, diabetes risk score as well at community events. So if anyone sees of that, if you see a free health check banner, it's likely to be either ARCC or Croydon BME. Yeah, you can find out your BMI. And you were saying if it's over 24.9 in the obese category, do you know roughly like the percentage of increase of breast cancer if it's above?
Sorry, I didn't get you.
So if your BMI index is above 24.9, what's the increase of the likelihood of developing breast cancer?
So yeah, in my presentation, I have mentioned, I'm not sure, but I was reading one article. They have actually mentioned the percentage. I'll share it with you later. It says if I'm not sure about the numbers, but yeah, I don't remember exactly. I'll send it to you later. You
Thank you.
can see they have written on it if you have certain increment in your weight, you increase the chance of getting breast cancer.
Yeah, sorry, I'm just yeah, I was trying to find the same slide as well, but I didn't. I thought there was we were also going on live on Instagram live, so I was trying to juggle a few things. Don't know if anyone else has any other questions, or we can just crack on with the second poll. So after that informative talk, let's see how we compare with poll 2, if I can open this. Okay. Here we go. Okay, so you'll see a poll coming up shortly now. So it's the same questions again, just comparing how we feel after that. So first question is, I feel confident to recommend cancer screenings to friends and family. Strongly agree, agree, disagree, or strongly disagree. And the second question is, cancer within my community is discussed, ... either openly, sometimes, a bit but needs more awareness, rarely, or never. And so we've had about a third of you have responded, and we've also got another question, which we'll have a look at once this nearly at 50%. Cool. Okay, so there's just a few more people who haven't yet answered. That's all right, I'll just give you a few more moments. Perhaps people doing a bit of online shopping for some omega-3 or like something. Okay. And I think we'll end that there. So thank you for that. Share the results. As you can see, it's a very positive outcome for question 1, with no one disagreeing or agreeing. So recommending screenings to friends and family. And yeah, quite interesting for the second question as well. So thank you very much for that. So Amjad has another question, which is there any evidence that suggests that diet and lifestyle can prevent hereditary breast cancer?
Yep. So actually, from genetical point of view, breast cancer risk is there. Yeah, it's a risk factor, but only 5 to 10% from genes you can get breast cancer. But a diet and lifestyle is also the risk factor, and a risk factor that we can do something about. We can't do anything about our genes. We can do something for a diet and lifestyle. If we are improving our lifestyle, diet and like physical activity and all, you can minimize your chances of having breast cancer.
Great. Thank you very much. And again, that's what this whole program is about as well. It's prevention is better than a cure. We don't want to wait until it's, until we have it. We want to prevent that as much as we can. So things like these talks and just spreading awareness as well within the community have been very effective so far. So yeah, I think just a quick heads up as well for some of our next events. So the next awareness talk that ARCC are hosting is going to be a prostate cancer awareness talk on the 18th of October with Patrick Williams from Prostate Cancer UK. The dates tomorrow and the 13th of October. I believe my colleague Lorraine, who's the project coordinator for Croydon BME Forum, has got a pop-up event at Croydon University Hospital, and the cancer champion Benny from ARCC will be there as well. Kiran, I believe as well, we've been in talks about a second nutrition awareness program, awareness talk for November, and that will be around prostate cancer and bowel cancer. Date to be confirmed, so please keep an eye on our social media for that. And some of you may have been at the stress management awareness talk we did last month with Teresa Groth Anderson, and that will probably be at the hub again. We will confirm details with you soon. Oh, and within that we've got, thank you, Mina. Got another question. Can some strands of cancers be contracted by any of the opioids in the expectant mother's future? Okay. So is that some strands of cancers be contracted by any of the opioids in the expectant? I'm not quite sure how to answer that. Right?
Yeah, I'm not sure. Opioid is like a medicine, is it?
Yeah, yeah. We would need to look into that. If that's a
Yeah.
medicine, yeah, need to dig a bit more. But yeah, you smashed through that really quickly, Kiran. It was really, really inspiring. A lot of good information, and yeah, I'd love to invite you back and to give another talk, maybe even give the same talk as well, because it's very useful information. It's not just a trending subject. This is, this is ongoing. So thank you so much for your time. I'll be in touch shortly.
Yeah.
And thanks to everyone else. Yeah, I hope you've enjoyed it. And again, just check us out on socials. We will be updating you soon. Right. Take
Thank you
care,
so
everyone.
much. Thank you.
Thank you. Oh, and check YouTube. This will be up on YouTube as well.
All right. Thanks.
See you guys.
See you.
Bye.
Bye.